Let's stay with this. This year's theme for World Cancer Day is Close the Care Gap, uniting our voices and taking action. During an awareness drive today in Johannesburg, the Health Minister, Dr. Phaahla, urged South Africans to go for regular cancer screening to ensure that they detect the disease early. For more on this, we are now joined by Joanie Sadie, the Corporate Relationship Manager at Cansa. Jody, a pleasure to have you on the program this afternoon. Firstly, talk us through the various initiatives you're undertaking as Cansa to highlight the importance of raising awareness campaigns such as the Hollard Daredevil Drive.
Hi, I'm Phaahla. Thank you so much for having me. Yes, at Cansa we believe that it's really important that every citizen of this country needs to have access to education and life-saving screenings. And this is why these corporate relationships are so important. Because, for instance, with the Hollard Daredevil Run, we are raising funds and awareness in a fun and innovative way. We're starting a conversation where, men don't usually like to go for these screenings. A prostate screening isn't a very pleasant thought, but these days you can actually just have a blood antigen test done. And just chatting to each other saying, hey guys, let's go, let's remember we have to go for our screenings every year because like you rightly mentioned, early detection is really key to beating cancer. And then from there, it's not just a fun day raising funds. We take the Hollard Man Band, we go out into the hard to reach and underserved communities, and that's where we then reach men and women who would not otherwise have access to these services, which they really do need and which they have a right to. So at Cansa we say, how can we close the care gap? What can we do to close the care gap? And it's all about being aware of your rights and knowing signs and symptoms of cancer. For instance, prostate cancer doesn't present symptoms very early on. However, if you get regular screenings, you'll get a better diagnosis. You won't be at a higher stage of cancer. You might be at stage 1, and your treatment options are just so much more, and your chance at beating cancer is so much more. And it's all really important that people know that lung cancer, colon cancer, breast cancer, and prostate cancer, these are all top 5 cancers. And that they know that they have access to free resources on the Cansa website and that they have access to help, psychosocial, physical, and otherwise.
Now, Joanie, why is this particular campaign special, especially in the manner that it encourages men to take responsibility for their own health?
Well, there is this thing that, and I had an interview earlier today where men agreed with me that the prostate cancer, it's difficult to talk about. It's not a very popular discussion to have. It's not something that men speak to each other with regularly. And the traditional prostate cancer test, it's unpleasant. However, now we know that we can do a full blood antigen test. So you can call a cancer care center. It's not a test that's readily available in state clinics unless you start presenting with symptoms. But like I mentioned earlier, you don't really present with symptoms early in prostate cancer. So you should go for a regular checkup. So you can find the cancer care centers and just see when the next clinic will be. We do a full blood antigen test. And this antigen test will then show you whether you need to be referred to a specialist or not. But what's also very special about this project is, like I mentioned, it's not a test that's regularly available at state clinics unless you start presenting with symptoms. And we have the Hollard Man Band that goes into those rural, hard-to-reach and underserved communities. These are the people where we really need to close the care gap, because we know that in the main metropoles, we do have access to internet and more information, where in those hard-to-reach areas, you might just have a state clinic that wouldn't regularly have this information available. So this is where we're starting to close the care gap. And we're starting to imagine a future without cancer, because this year we're asking ourselves, what part am I playing in imagining a cancer-free future? And this is where we can really say that in these kinds of corporate taking hands partnerships, we are closing the care gaps. We're taking the information, education, and life-saving screenings to those communities who really need them.
Now, this is a very popular initiative as well. Of course, many would remember the sight of men in their purple underwear, if one may will. But what is the reach of this initiative? And talk to us more broadly about how the funds received from the Phaahla Daredevil Run are actually used.
Okay, yes. We're very proud to be a beneficiary of this wonderful initiative. You know, people think you're just putting on a purple Speedo and running and having a fun time. But actually, it's so much more about it. There's so much more around it, because we're starting a conversation that's non-intimidating about something that people tend to avoid, and that's just human nature. You don't want to, you realize something's wrong, but you kind of want to avoid the topic because you don't want to get that diagnosis. So in the first place, first and foremost, this initiative is starting a conversation in a fun and less intimidating way that can start men speaking and even women speaking about testicular cancer and prostate cancer and going for regular testing, just educating men. And this year it's been an even bigger success. Amazingly, during COVID, the event started going national. So now you don't have to be at Zoo Lake to take part in this event. You can be anywhere in the country and still take part. And it's been such a success because I think it's really starting a conversation where men are saying, and they're coming to us and saying, you know, I was diagnosed with prostate cancer. It's still early stages, and I wouldn't have gone for this prostate screening because it wasn't something that's being discussed. People think that it's something that older men need to look at, but actually younger men need to go for regular screenings as well. It's not an older man thing. And then again, I just have to say that it's about also then receiving these funds. And then we have the Phaahla Man Band that's also sponsored by Phaahla. And it takes a nurse and a social worker into the rural, hard-to-reach areas, and that's really underserved, taking education there, doing screenings there, informing men and women of their rights. And even, you know, going beyond that, our psychosocial support, which is also sponsored by Phaahla, where you can phone a toll-free line or you can send a WhatsApp and you can be really supported in 7 different languages and really know that you're not going through this alone, and that is closing the care gap. So, you know, it's strengthening areas where government really needs us to take their hands and help them close the care gap.
As we wrap up our conversation, how can people get more information about this very important initiative, and how would you encourage men and boys as well to take part?
Well, Cansa, that I'm very glad you asked me that. We've already started planning for this year's Phaahla Daredevil Run. But for now, you can go to www.cansa.org.za. You can call our toll-free number 0800 226622. Send an email to info@cansa.org.za. and we'll be able to assist you with more information, or you can go to the Daredevil website as well. If you want to get involved, if you schools, clubs, anyone is very welcome. It doesn't matter where you are, even if you're just a group of friends or just a single guy wanting to do a quick lap around your yacht and show off your purple Speedo. It's for a good cause, and it's really raising awareness across the country.
Joanie, thank you very much for your time. That was Joanie Sadie, the Corporate Relationships Manager at Cansa.